You ever wonder what really goes on in the operating room? Well, today, my girlfriend was called during lunch with a friend. They were about 20 minutes into their lunch when the call came in. The urgency was a code blue, meaning a patient was in critical condition. So they dropped everything, ran to the hospital. They were 2 of 3 gynecologists on call. The patient was in the operating room and they needed help. Apparently, these 2 gynecologists had once again messed up open surgery, and they did not know what to do. So my girlfriend and her friend were called in to save the day. The surgery was on a woman with cervical cancer. The surgical plan was a so-called wartime eggs operation. It is a radical surgery where you remove the patient's uterus, pelvic lymph nodes, ovaries, and vaginal tissue right down to the vaginal floor. It's a pretty straightforward operation if you know what you're doing. But these 2 didn't. At some point during the surgery, they butchered the poor woman so badly that they couldn't find the patient's urethra. They were so incompetent that they even cut a hole in the patient's bladder. At that point, they were like, oh dear God, we're in too deep. We don't know what we're doing. So who are you gonna call? They called my girlfriend. She found the urethra and completed the surgery on her own while the other 2 incompetent douchebags just hung around and watched her. Now, this is not an isolated case. These specific doctors have opened up many a patient without mastering the competence of performing the procedure they were planning to do. Apparently, it's a typical gynecologist thing, and many a time a general surgeon or urologist had to intervene to save the patient. The conclusion is simple. These guys should never try such operations. They are simply not capable. They will leave stuff inside, butcher the patient's insides, and then get completely lost. Sometimes at a heavy cost. But this doesn't happen just in this hospital, it happens everywhere. Surgeons are trained to take on additional procedures if needed. It's called being on call. But the problem is that there is no effective system to stop incompetent surgeons from doing harm. They will often do procedures that they haven't mastered yet. They will often ruin bladders, endanger patients and unborn babies, risk a patient's future by not performing cancer-related surgery adequately and leave a lot of it inside. Now, the way this story ends is that the patient survived, but that doesn't always happen. And the details of this case will never be known. The gynecologists will try and do everything to prevent that from happening. And they will succeed. This is what the surgeons won't tell you. This is what you'll never know. Thank you for watching. If you liked the video, please hit the like button and subscribe to the channel. Until next time.